Hi, welcome to episode 11 of Osce with Mudau ES. Today we'll be doing TPR, which is known as temperature, pulse, and respiration. TPR is defined as measuring temperature, pulse, and respiration to make an assessment of the normal and abnormal functioning of the body. As part of standard precautions, make sure that you always wash your hands before doing or commencing with any procedure. Greetings is very important. Make sure that you greet the patient before you do anything. After doing that, introduce yourself by showing also of the name tag, which has your name and your picture, and make sure that you also introduce the facilitators or the supervisors who you will have came with. For you to get a proper consent, explain thoroughly the procedure that you are going to do with the patient, if the procedure is going to take time, if it's going to be painful or less painful, if it's going to be irritating on the patient's skin, and so on. Once the patient understands the procedure that you need to do and the complications that comes with it, they will be easily able to make a conscious consent and give consent for you to proceed. Once consent is given, do the following. Assess the patient's comfort before you begin with the procedure. This is to determine if the patient needs anything before you start. Check the immediate environment of the patient. This is to ensure safety for the patient, and also check the prescription, that what is the doctor prescribed for the patient to be done under the temperature, pulse, and respiration. Identify your patient as in accordance with your hospital policy. This is a critical point. Compare what the patient is saying against the identity belts that he or she has, and also against the computerized forms of the patient. To have a successful procedure, the following tools are very important to have. These include a thermometer to measure the temperature of the patient, a watch with second hand so that you can time your whole procedure, the gloves, the unsterile gloves, so that you can wear them to prevent cross-infection, paper towel to wipe away perspirant from the patient's armpits, antiseptic hand spray to decontaminate your hands throughout the procedure, a receiver for soiled disposable items. This is where you'll discard your disposable thermometer, your gloves, and your used paper towel, and a control chart form where you'll be documenting your findings, and also so that you can be able to compare the previous ones and the ones that you've discovered today. To prevent cross-infection, please decontaminate your hands using the antiseptic hand spray. To start with the procedure, let's assume that we are using the disposable thermometer. It is very important to start by checking the expiry date so that you may be able to get the correct readings. It is also very, very important to make sure that you read the instruction of the thermometer that you have, which has not expired. This will determine that if you are using it under auxiliary, how many minutes should you put it under? If you are using it orally, how many minutes should you use it? And also on any other format of using the thermometer, under how many minutes should you read your thermometer readings? Let's assume again that we want to use the auxiliary temperature readings. We must make sure that we wear our gloves and use the paper towel to dry or to pat dry the patient's armpit to remove perspirant. Once the armpit is dry, place the thermometer securely under the patient's arm and make sure that you check your second hand watch and start reading from the first minute that you come across for a total of 3 minutes and or as instructed by the instruction on the thermometer itself. Do not remove the thermometer up until the required instructed time has been achieved. Once the instructed time has been achieved, the readings that you'll find thereafter is the reading of the temperature for the given patient. Simultaneously looking at your second hand watch and looking or locating your radial pulse, once the first minute has commenced after inserting the thermometer, start checking for the pulse using your 2 fingers. Once you've located your pulse, make sure that you start reading or checking the rate, the rhythm, and quality of your pulse starting from the second minute. Do so for a full minute to make sure that you detect the correct readings. Without removing your fingers from the radial pulse, and without making sure that the patient notices that we are now watching her chest movement, start counting from the last minute, the rate, the rhythm, and quality of respiration of the patient to make sure that you get a total number of breaths per minute. To maintain a safe and healthy environment, clean the surrounding of the patient once done. Discard accordingly to the waste segregation policy. Make sure that you discard your gloves, your paper towel that you used, and also the disposable thermometer. Once done with these two, make sure that you decontaminate your hands using the antiseptic hand spray. After doing the procedure, compare your findings with the previous recordings as to check if the data has improved or worse, or to determine any possible problems that the patient may be having. It is very important to verbalize the findings to the patient. This means feedback in simple terms. This is to make sure that the patient receives information about the procedure which was done to him or her. At this point, it is still very important to keep on evaluating or assessing the patient's condition to check if they are still okay or need anything before you finish your procedure with them. Using the control chart form, record the temperature, pulse, and respiration to ensure continuity of care, and also again record in the patient's progress report to report any findings that you have found. Once done, do not forget to also go to your registered nurse to report any abnormalities. Do not forget to thank your patient for the opportunity they've given you, and also thank, lastly, the assessors for the time they've given you to do the procedure.